Thank you. Thank you for tuning in to another educational webinar. This one is actually in place of a lecture that I was supposed to do at Fitness Fest 3 weeks ago, but I had completely lost my voice. So it is somewhat back. Here I am giving you that session or that course. So welcome to everyone. My name is Dr. Slickle, functional podiatrist, human movement specialist, and founder of EBFA Global and of Naboso. We are going to take a dive into a concept called sensory-based balance training. You could think of this almost like a little snippet or teaser of our all new neurosensory specialist course. So if this is something that is intriguing to you, the concepts that we go over today or in this webinar, then please do make sure you check out that training. This is going to be recorded like all of our webinars, which means you can watch it again, you can share it. If you get disconnected or you have to log off, don't worry, it is recorded. It will be on the EBFA and Naboso YouTube channels. After I go through the content, I will have some time for questions. So make sure you type those into either the chat or the Q&A if you happen to have questions. Here we go. So we are going to take a deep dive into this concept of sensory-based movement. And we want to be thinking about how balance is based off of a sensory experience. Actually, everything is based off of a sensory experience. The way that our muscles contract is based off of sensory stimulation and sensory perception. So when I, as a podiatrist, am looking at someone with movement imbalances or chronic foot pain, whatever it might be, I'm always looking at it initially from this sensory lens, meaning what is the quality, the quantity, the perception, the interpretation of the sensory information coming in? Meaning, can they feel the ground? Can they sense shifts in their joint? Can they access their vestibular system, right? So what could be perhaps interjecting or getting in the way as far as the optimization of that movement pattern? Or in this case, we're going to be focusing on balance. So for any of the listeners, if you currently do balance-based exercises, fall reduction programming, whatever it might be, just think of some of these concepts as little ways you could sprinkle in or enhance what you are already doing. Now, balance is based off a body schema. This is one of the biggest takeaways of this lecture, is going to be balance is based off of body schema. What does that mean? So body schema is our perception of our physical body. It is our mind's eye to our physical body in space, which means that if I were to shut my eyes, I can still sense my body. I can sense my arm and my arm movements. I can sense the space that my arm is taking up, which if I think about my wrist, right, I could kind of make like, I think that, you know, the circumference of my wrist is about this, right? So I'm using a mental perception to create a image and a relationship to my physical body. That's body schema. That is built off of a combination of proprioception, mechanoception, vestibular, visual. All of our sensory input systems are integrated into creating this body schema. Now, what I do, I'm going to go back just one slide real quick, because I don't want to get too ahead of ourselves. One quick concept when it comes to balance optimization in an athlete or in someone you're trying to reduce a fall is that injury, concussions, stroke, just age starts to interrupt the accuracy of this body schema and this perception of our physical body. Now, if we just take for a moment someone who is older and we're trying to reduce falls, is oftentimes as we get older, entering like our 70s, right, you start to get this rapid change in morphology because of the decreasing muscle mass and the increasing adipose tissue. So it becomes even more difficult or shifting to that individual to stay connected to their physical body when it's changing so much. And if we don't do practices or techniques to strengthen that muscle, that skill of connecting to our body schema in an accurate way, that, in my opinion, is a big contributor to falls. That individual just has no idea where they are in space. An athlete, similarly, right? That athlete has to have a very accurate, acute, fast perception of their physical body. So when they are navigating another opponent or a teammate or an object, that they can very quickly enhance that relationship. Okay, so this concept of body schema, really, really important, that I want to be one of the biggest takeaways. All right, now, if we go into the sensory input systems that allow us to maintain balance, there are going to be 4 main input systems that we're using. So we are going to use our eyes, our ears, our joints, and our feet or touch. Okay, so it's going to be visual, vestibular. Vestibular, or the ears, are going to represent the vestibular system, so the inner ear, but also audition. So sound is also very important to how we control our movements. The joints is going to represent proprioception. We'll go into that. And then the bottom of the feet is going to represent mechanoception, or haptic and touch nerves, which are very important. So we use all 4 of these input systems in order to maintain balance. Now, I like to explain that I think of this like a pie. And all 4 of these are working together to complete that pie. Now, if I take away one, I have you shut your eyes, then the other 3 have to make up the difference of what the visual was to complete the pie. Hopefully that makes sense, okay? So you're going to upregulate more probably in the proprioceptive. That's going to be the most common that we would upregulate, okay? Now, all of these work together. They integrate together in the neurosensory course. We call this multisensory integration. It's how they relate, and they actually further enhance each segment's input or contribution to overall brain activation. Okay. Now I'm just going to briefly go over each of them so that we kind of create this foundational appreciation for each of them. The visual system, big takeaway I want you to think about with the visual system is that it is oftentimes the most dominant one, which means if your client is standing on a wobble board or a Bosu, right? This is a contribution of these 4, right? If they're in shoes, on a Bosu or a wobble board, technically that tactile component is being taken away a little bit, which means they're going to be upregulating the other ones a little bit more. If you're on a soft Bosu, now that softness of the Bosu kind of took away a little bit of the proprioceptive. So when we stand on unstable surfaces to maintain our balance, or we challenge balance in some way that we'll talk about, the easiest one for the nervous system to upregulate is going to be the visual system. Now, this could be good in the sense that there's at least a strategy to maintain your balance, but where we want to be a little bit aware is that if you have a client that has compromised other systems, they have hearing loss in one ear, they have neuropathy, they sprained their ankle, whatever it might be, and they become very visually reliant, what happens when an unexpected reason of them losing their visual acuity occurs? That can be very damaging to that individual, and they can be very motor compromised. They will most likely start to lose their balance, their movement confidence. So we want to make sure that we are not just saying, hey, if I disrupt your systems and you become very heavy visual, hey, I'm glad because you're at least standing, right? And maintaining your balance. What I want you to actually think is, okay, yes, there is going to be this tendency to shift towards visual, okay, but what can I teach you and assist you to focus on those other ones still? Give you a quick example. Using kinesiology tape, rock tape, things like that. Let's say on the lateral ankle, and then you're doing drills, you can then say, okay, because I'm using K-tape around that ankle and the proprioceptors that sit around that joint capsule, I'm going to help you upregulate that input system so that you're not only reliant on the visual system. Okay, so that's an example of how you could support the other systems. Obviously, Naboso as well is another really good one. Okay, now the vestibular system, something fun about the vestibular system is that it is the first sensory input system to develop fully in utero. So by 5 months in utero, the fetus is able to hear. They're also establishing the relationship to gravity. It is connecting to your postural muscles, to your core, actually to your reticular activating system in the brain, which we go into in the neurosensory course. It is a very important system for how we relate to gravity. And you can oftentimes see this in the cases of when people get a vestibular disruption, such as vertigo, Meniere's disease, things like that. It can be very flooring to these people. It can just really put them down, make them extremely nauseated because of that disorientation to gravity. Okay, I had mentioned that audition or sound is the other aspect of ears that I want you to think about. Where sound comes in is really in the form of rhythm. When you integrate rhythm, sound, beats, a metronome, something like that, that the individual is following during the movement pattern, it can help them support and connect to that movement easier. And this is really just based off of our natural tendency to want to gravitate towards rhythm. And a lot of that is actually starting in utero when we are introduced to rhythm because of a heartbeat. And we're also introduced to rhythm in the mother's walking. Now, the other two big ones that I'm going to focus on outside of visual vestibular is going to be, of course, the ones that we most often think about when it comes to balance is going to be proprioception and mechanoception. Proprioception is going to be the nerve endings and the stimuli around joints. So the joint capsule, the muscle tendon junction, the ligaments, and these proprioceptors, such as the muscle spindles and the GTO, help to connect to what's called joint position sense. So we are only as stable as our ability to perceive a shift in our mass or in our joint. Okay, so to have good balance or to be stable on one leg, let's say, requires to have an accurate, very rapid position of that joint, all the joints, and any shift in any of those joints. So our body globally has a center of mass, which is between L5S1 or between your ASIS, but then also locally, each joint, so like joint by joint, each joint has a center of mass as well. And that shift in that joint's center of mass is very, very necessary to maintain dynamic balance and stability. Okay, so you always want to focus local and then you want to go global and then zone back in local and then global again. Okay, kinesthesia, tension, velocity, those of course are important as well. Mechanoception, super important. Anyone who's taken any of my courses or lectures before, you should be familiar with mechanoceptors. These mechanoceptors are your touch nerves. They're found on the palm of the hand and the bottom of the feet. This is where the science of Naboso comes into play. And you can see over here that there's 4 main mechanoceptors. You have SA1, SA2, FA1, FA2. Okay, now the stimuli that each of them is sensitive to is really what we want to focus on. The Mercaldus, the SA1, is sensitive to 2-point discrimination or texture. Now, the best analogy of what is sensitive or stimulating to the SA1 Mercaldus is Braille. So when your hand reads Braille, the Braille dots, the pattern, the distance between the Braille, you are essentially reading 2-point discrimination. Okay, Now, Naboso and all of our products are based off of that exact same concept. So the little pyramids and differentiation points between the pyramids, the points, is really what you are feeling or perceiving through the nerves in the bottom of the feet and the palm of the hand. That's the science of Naboso. Okay. Ruffini ending is sensitive to stretch. FA1 Meissner corpuscles, FA2 Pacinian corpuscles are both sensitive to vibration. Now we feel vibration every time your foot strikes the ground and you experience ground reaction forces or impact forces. Okay, so impact forces are vibration. We use vibration to know how hard we're striking the ground, and that controls a loading response. Okay. If we cannot feel vibration through the feet, we will not be able to control as efficiently the loading response. And this is where you can start to see a lot of impact-related injuries, is a lack of perception of the vibration and the impact from the ground. Okay, another fun fact is that 70% of the mechanoceptors in the bottom of the feet are sensitive to vibration. So the way that I interpret that is that the most important sensory stimulation coming through your feet is vibration. We feel vibration when we move, when your foot strikes the ground. So that means that to keep your feet sensory strong, to allow movement longevity, you have to keep moving, right? Movement feeds movement. You got to keep moving, keep moving, keep moving. Okay. Other fun fact, last fun fact is that the peak sensitivity of these mechanoceptors in the bottom of the feet is age 40. By the time you are 70, you need twice the stimulation to create the same response. So that's why I'm very much into Naboso, barefoot, minimal shoes, all of that for our baby boomers. Okay. Now, Naboso as a product line, all of our products are essentially an SA1 mechanoceptive stimulation tool or tools. The distance of those pyramids on the Naboso products is very specific. The height and shape of our pyramid is very specific. And then the hardness of our materials is very specific, right? So you always want to dial things in. I am also a huge fan of whole body vibration platforms. The efficacy of whole body vibration platforms is based off of using a proper frequency and amplitude to control the results that you want to get. Okay, so very similar with everything. You want to make sure you're dialing things in. Okay, now what I want to do is start to get everyone connecting to their foundation so that we can feel our feet. Now, if you happen to have any of the Naboso products, I encourage you to get those. I will be queuing and recommending or referencing the mat. So one of our mats, I actually have flooring. I'm in my podiatry office right now, and I have flooring in my entire office. So I'm going to be on the flooring. But if I had a mat, which I do right there, but if you have a mat at home, right, you can kind of mimic that off of the mat. If you don't, no problem, right? No problem. I just highly encourage you to check it out. And then the other ones that I'm going to be referencing is going to be our neuro ball and then our sensory sticks. Okay, so the first introduction to sensory-based balance training is that you have to first make sure that you are establishing weight distribution awareness. So I'm going to stand up, I'm going to rotate over here. So I'm going to get everything ready. And if you want to join me, that would be incredible over here. Perfect. So I'm going to be here. This is going to be the next slide that I go through. So I'm going to actually pull the slide off so that you can see me bigger and kind of see what I'm doing here. Okay. Excellent. Great. So what I want you to do, 1 second. Sorry, you guys. Okay. So what I want you to do is take your shoes off. Shoes and socks are off so that you are standing here. If you have a Naboso mat, great. You're going to get the Naboso mat out. If not, no problem at all. I want you to stand with your feet shoulder width apart. So feet are shoulder width apart. Hands are by your side. And I'm just going to have you shut your eyes for a moment. And as we stand here with our eyes shut, feet shoulder width apart, nice and relaxed, I want you to start to connect to your body's weight distribution, pressure distribution. So if you were to assess and feel where a majority of your pressure or weight is distributed, do you feel like you have a little bit more weight on your left foot or maybe your right foot? Do you feel like you have a little bit more pressure on the front of your foot or maybe the back of your foot? Or how about if you thought about each foot individually, do you have a shift perhaps to the lateral or the outside of your foot or maybe to the medial? So just take a moment and see if you can feel passively when you're relaxed, where does your pressure tend to shift? Now, if you are on a Naboso mat, how you would use it is you would use the texture to enhance the awareness and perception for the client or the patient. If I'm never barefoot or I don't train barefoot, it's going to be very difficult for me to possibly feel or know where my weight distribution is. So that's where you could use Naboso as a training tool or a foot awareness weight distribution tool. Okay, now as I stand here, if I just kind of passively think about my feet, I feel like I'm a little bit more towards my heels and to the outside. So that's just kind of my passive position, right? And then you, the trainer, coach, or yourself say, okay, well, what does that mean to the rest of the body? If I, Dr. Emily, am standing kind of to the side of my feet like this, I'm always getting tighter IT bands into my hips, right? That's putting my foot into a more supinated position, a more rigid position. So finding center for me, mobilization of my feet and my hips, me personally, is very important, right? So you interpret that for yourself and you interpret your awareness for your clients and your patients, okay? Now what we want to do is we want to set our base. Now, setting your base, when I say these words to a client or a patient before any exercise or before I would go into a balance technique, it's going to be about finding even body weight distribution, finding a neutral foot, and getting into our tripod. Okay, so let's start with our tripod. Your foot tripod is going to be underneath your first, fifth, and your heel. You can lift your toes, spread them out nice and wide. Spread your toes nice and wide, and then place them back down onto the ground. Okay, now as you do this, as you find the tripod, spread the toes wide, place them back down. You should now feel that you have a more centered or even body weight distribution. Like I feel more centered now, okay? If in your client, especially pronated feet, where they're standing like this, okay, you may need to have them rotate into a more neutral position, okay? That rotation this way is going to get them into neutral. So just add on in that overpronated client that they may need to first externally rotate, right? So kind of screw into the ground, find the tripod, lift the toes, spread them out, place them back down. Boom, okay? Now, the last thing that you want to do for setting your base is connect to the digits. The connection of the digits is just, I call it saying hello. So you just want to say hello to the digits, okay? That means with like 10% of your foot strength, push the tips of the toes down into the ground, okay? And then release. Just a little tips of the toes down, hello, and then release. Now that little hello tension of the digits, if that is hard for your clients to do, then I encourage you to do what's called a forward lean. In a forward lean, you're going to imagine that you are stiff as a board, and then I'm going to rotate slightly so that everyone can see what I'm doing. I'm still in my same position. And then I'm going to lean my body forward. So I'm just slightly pitching forward. As soon as I do that, my digits push down, and then I come back into a starting position. Gentle rock forward. It's not a competition of how far you can go, right? It's literally like 5 degrees. Slight shift, back center. Slight shift, back center. Now, with everything that I teach, I always cue the breath and more of an integrated technique, okay? So what we would do with that is that you would want to exhale as you lean forward, inhale to come back. Now that might seem opposite, but just trust me. Exhale to go forward, inhale to come back, okay? Inhale. If you can connect to your core at the same time, then beautiful. Okay, so again, basic foundation when I'm working with a client, or you are my client or patient, and I said, set your base. That would mean rotate, tripod, spread toes, toes wide, connect the digits, obviously connect to the core as well. You shouldn't have to keep doing the forward lean to set your base. You eventually want to know what that sensation feels like, but now we're essentially here and ready. Okay, perfect, great. So that is setting your base. Now, the next thing that we would essentially do to get into the feet even more is going to be releasing your feet. Now, why I like to release the feet is because research has shown that just 5 minutes of a foot release can immediately improve balance. So if I'm going to be doing a balance program, I want to do whatever I can to prepare them the most effectively to have the best balance, okay? The other nice thing of the neuro ball that I'm going to show you with is that we're not just doing trigger point release, but because of the textural design, we're activating the nerves. And your tactile aspect of your feet is how you connect to your nerves, okay? So we're going to take the neuro ball, and there's going to be 5 points that we're releasing. So let me draw those 5 points and show you, okay? Just grabbing a pen real quick. Those 5 points. Down slightly, what we're doing is, I'm going to draw them on, excuse me. 1 is going to be the base of your heel. 2 is going to be the middle of your arch. 3 is going to be the ball of the foot. 4 is going to be under the cuboid on the lateral side of your foot. And then number 5 is under your navicular, where your posterior tibialis is. So let's see how good my balance is. Okay, so there we go. And then I always show you guys. Okay, so those 5 points. 5 points. Okay, base of the heel, middle of the arch, ball of the foot, lateral just under that cuboid, medial just under the post tib. What we're going to do is 30 seconds each point, 30 seconds each point, and then we're going to keep moving. If you are using the neuro ball, you're going to do the first round with the domes, and then on the inside there's actually a little black ball, and you would repeat each of those points with that black ball. Okay, if you have the neuro ball or you're getting the neuro ball, right, the way that you open it is you take the seam, place it on the floor facing up, put your heel on the seam and push straight down. So it just split open, okay? I'm gonna place the domes on the floor so that we can see that. Okay, I'm gonna place those on the floor, beautiful. Okay, and we're gonna go into position 1. Now, if you're joining me and you don't have the neuro ball, not a problem. You could use a golf ball, a lacrosse ball, the handle of like a small 2-pound weight. If you have the sensory sticks, you could use those. So I'm open to whatever tool you use. I just want you to do the release. Okay, so we're doing a 5-minute foot release on 5 points. Each point is 30 seconds. And then we proceed to the next one. If you're using the neuro ball, round 1 is with the dome. Round 2 is with the black micro that is on the inside. So let's find position number 1. So on position 1, you can see in the camera where it is on my heel. So I'm not on my calcaneus because that's not what position 1 is. You're just on the bone. It's going to be just forward of the calcaneus. So I am here. I'm on both feet at the same time, and I'm controlling the amount of body weight that I have under my feet. Let's slightly bend our knees. We never want to hyperextend those or lock those. I'm going to hang out here for 30 seconds, right? Hanging out. Nice and relaxed. I feel the texture. It's really waking things up. It's also stimulating my circulation, which is awesome. Okay. After 30 seconds, position 1, you know the drill. You're going to go to position number 2, into the middle of the arch. Typically, this is the most sensitive one for people. So if it's a lot of pressure, just do 1 foot at a time and then proceed to the other one. Okay. 30 seconds, position 2. We go to position 1 for 30 seconds. After 30 seconds here, you're going to go to position 4. Here we go. This one, love, love, love this one. This is getting your perineals. For anyone who has sprained their ankle, this is really good. People with high arches, this is really good. And obviously anyone with perineal tendinitis or IT band issues, very good here. Okay, we're doing number 4. And then finally, you're going to number 5. Number 5 is going to hit that abductor hallucis, your post-tib tendon under the navicular. Great release as well. So we would do 30 seconds each of those points. If you're doing both feet at the same time, awesome. You would essentially put the black micro on the floor and repeat it. If you're not and you're using a golf ball or something else, then just make sure you do the other foot 30 seconds each point. Okay, so we did 5-minute foot release. Now, when we get into a position of saying, set your base, right? So I'm going to release, set my base, right? Probably activate with a few forward leans. This is how I would essentially warm up someone. And then I would get into a full single leg stance. Okay, and then when I get into that single leg stance, I'm going to start to incorporate some other techniques to challenge their balance. The one that I'm going to mention here is going to be a couple eye movement exercises. So that's going to be the last thing that I integrate for our sensory-based balance training. Now, before I do that though, we are going to go over what are called balance hacks. Okay, balance hacks. These balance hacks are based off of how we actually maintain our balance. So if I'm going to show you a balance exercise, I'm going to access the other sensory input systems to help you maintain your balance. Okay, so the first balance hack is going to be visual. That means that if I'm balancing on one leg, or I'm your client and I'm having a hard time, I'm taking in a lot of stuff in the room, you're going to have me really focus in. Focus on one point, really spot, use some acute visual input. Okay, that's going to be your first balance hack. Your second balance hack is going to access the nerves on your hands. So this is where our sensory sticks are going to come in. Okay, so we are going to pull into the sensory sticks. These are 2-pound weights. So the 2-pound weights of the sensory sticks have the Naboso texture on them, but they are weighted. So the weight, the resistance, when you hold something that is weighted, you actually pull on the joints, stimulating the proprioceptive system. So technically, the sensory sticks are mechanoceptive and proprioceptive. So to stand on one leg or to do a balance exercise and hold the sensory sticks, I am accessing 2 input systems. It is a balance hack. Okay. Your third hack is going to actually integrate our myofascial system. Your fascia has over 100 million sensory nerves. 100 million sensory nerves. These nerves in your myofascial web that wraps around every muscle fibril, right? All your bones, your joints, your ligaments, the periosteum, all of that tissue is sensory seeking. It is packed with proprioceptors that you activate when you contract your muscles. So the way that you can access your myofascial web during a balance exercise is going to be contract your muscles. Now, the way that we're going to contract our muscles is we're going to create tension. So what I'm going to have you do to create that tension, as an example, let's say we're standing on the leg, you're holding the sensory sticks to get your mechanoceptive tactile, proprioceptive at the joints. You're staring at one spot in front of you, really zone in, don't forget your foot. You got to keep your base set, right? Okay, now to add in tension, I want you to squeeze the sticks, right? What I'm doing is I'm making a really tight fist around these sticks. As soon as I do that, I feel my core go boom, right? It is activated. My entire system is nicely integrated. Let's say you don't have the sensory sticks. What you could do is just make a fist. You could hold a dumbbell, so a smooth dumbbell, like a 2-pound dumbbell. And then same thing, just ask your clients to squeeze the weight, right? So don't hold the weight, but like hold the weight, okay? That is going to be your third hack. And then your fourth balance hack is going to be to breathe. So never ever hold your breath, okay? So again, as we're kind of putting this together, how can you start to apply this with your clients, okay? Is what we're looking at here is that you have activate your feet, release the feet for at least 5 minutes before you do balance exercises. Make sure you understand how to cue, set your base, okay? You need them to connect to the tripod. The digits are long, straight, and flat. If you've seen the toe spacers by Naboso that everyone is bananas over, the way that toe spacers work is they help your digits stay long, straight, and flat. Okay, you're going to connect into your digits. That's called short foot. Put some tension in the foot. And then you're going to go into your hacks. Visual spotting, right? Something in the hands. Be barefoot on the Naboso mat. To activate proprioceptive, something weighted. So they're holding something, right? You could also use a wrist weight, which is really good. To get into the fascial system for tension, actually contract, make a fist nice and tight, tight, tight. Boom, totally activated. And then the final one is to never, ever hold your breath. Okay, so what we're going to do is we're going to do just 2 little eye movement exercises, and then we're going to pull it all together, and I'm going to take any questions that you guys may have. Okay, so let's get started on our right leg. Set the base, foot tripod, spread the toes. Here we go. Connect the toes to the floor. Opposite leg comes up, so you're balancing on one leg. Your eyes are straight ahead and you're looking at one spot. Just really focus on something, okay? If you have the sensory sticks in the hand, acknowledge the texture. Feel the texture in your hands. Beautiful. I want you to turn your head and look over your right shoulder. Perfect. And then bring the head to the center. Make a nice tight fist. Look over to the left. Woo, Dr. Emily. And then head to center. Let's do it one more time. Look to one shoulder. Look center. Look to other shoulder. Look to center, hold. Okay, stay with me. Stay on that same leg. Okay, here we go. I want you to shut your eyes for 10 seconds. Those eyes are shut. If you feel that wobble, that is totally normal. Just go with it. You are a tree, not a flagpole. 4, 3, 2, and release. Good job, you guys. Open those eyes, switch to the other side. Here we go. Same thing. Now, I want you to make sure that that leg is not totally straight. I need a slight bend in the knee, slight bend in the knee. Here we go. Opposite leg goes up. Find your position. Okay, get your hacks, your balance hacks, and then here we go. Look over one shoulder, spot something. Head goes center, spot. Look over the other shoulder, spot. Woo. Head center, spot. One more time. Over the shoulder, center. Over the other shoulder, center. Stay there. Shut your eyes, 10 seconds. Try to relax into it. Don't forget the breath. If there is a wobble, go with it. It's totally fine. Perfect. 4, 3, 2, and release. Good job, you guys. Excellent. So the way that you would want to incorporate this into any balance exercise you do, think about the feet, set that base, release those feet before. Remember those 4 balance hacks. You're using the visual, you're using the tactile, you are using proprioceptive when you can, you're using tension, and you are using breath. Okay. Now I'm going to hop on over back to my table and we're going to go into some questions that you guys may have. Hey, perfect. So let's come on over here. I'm going to open my PowerPoint back so that you guys can see that and then go over the last slides that we did not cover. Okay, perfect. Okay, so now here, the sensory stacking, this concept, because I'm going to be sharing the PowerPoint with everyone. This concept of sensory stacking is essentially what we're doing. Those hacks are stacking. So we're integrating the hands, eyes, joints, all of that together so that you are able to get even better results. Okay, activating the eyes. So when you activate your eyes, you actually improve someone's balance. So I just incorporated one of those exercises. There's other, you can do tracking. You can do a saccade, which is looking right, left, right, left, right, left with your eyes, things like that to train what's called the basal ganglia. Again, we go into the neurosensory course of much more kind of central nervous system reason for all of these things. These are your balance hacks. These are the eye movement exercises that we went over, and we are going to integrate that. Okay. What I want to do is take any questions that you guys have about these concepts so that we can make sure that you have some of these little pearls to start applying with your clients. So Ruth says, how would you get a good set to your base when a client has hammer toes? So that's where, Ruth, and for everyone, that's where these would come in. So that's why I would recommend the toe spacers as soon as someone has hammer toes. Because what is really important to understand with hammer toes is that as soon as we start to get these digit contractures, you lose what's called purchase. And your toes have to be on the floor to maintain your balance. If they start to lift off of the floor because they're contracting, that in itself is a huge contributor to fall risk for these clients and these patients. Okay, so toe spacers, get them down, stretch the extrinsics. In some cases, I mean, they might need to do surgery to get them down. But when I recommend hammer toe surgery to someone, it's not from a cosmetic reason. It is for a movement balance perspective. Okay. And do email me if you have more questions about hammer toe surgery and all that stuff. Okay. David said, is there another training? He has to work on that Saturday. David, yes, we actually do it once a month, every 6 weeks. So if you cannot attend the May 21st, just follow what we do and we'll make sure that there's another one that you'll be able to attend. Okay. Absolutely. You are welcome. All right, Linda says, what should I do with older clients who don't want to remove their shoes? So this is what I typically would say. So shoes inherently disconnect us from the ground, all shoes, but especially thicker shoes that quite possibly your client is in because they're older. The cushion in the shoe that's disconnecting the client. Could we say at the start of the session, I'm going to have you release your feet on the neural ball 5 minutes, and then we're going to put your shoes back on. Right? So you at least woke up, released, and helped them to connect to their feet in the shoe. That's the first thing I would do. That's the layer 1 introduction. What you could also start to do if you do that enough and they're open to it and they actually don't mind it, is to say, okay, can we release your feet for 5 minutes and then do maybe like 5 minutes of some stuff without your shoes on, and then we'll go back to your shoes, right? So you're kind of like teasing it in and allowing them to adapt to it on their own. The other thing that you could do is you could get the Naboso insole and put it in their shoe and say, when I train you, I really need you to have that insole in because I need you to feel your feet and the ground so that we can work together to improve your balance. Okay, Linda? Gretchen says, how do you start balance work when you can't stand on one leg yet? Yeah, so you could do a narrow stance. So just bring your feet close together. You could do like a kickstand. So be on one leg and then just kind of put the toes on the floor for the other one. That's how you could do it. You, of course, could have a chair nearby or something that, or by the wall. When I used to teach balance classes before COVID in New York City, I would have certain clients or participants that would be near the wall. They wouldn't use it, but it would be, they want to be near the wall just to subjectively feel more confident. So you could kind of try that as well and see that maybe that helps them, or the chair nearby. They're not going to totally be hanging on it, but just nearby, it's just there. And then they feel more confident with that. Okay. Sebastian asks about the spacers with bunions. Absolutely. Yep. So hammer toes, bunions, neuromas, really everyone, seniors, people who are at fall risk. So I consider this a balance tool. Okay, great. And then this individual says, would the spacers help if someone has had sesamoid surgery? Yes, and this might not make sense, so just kind of hear me out on it, okay? So the sesamoids, which are two little bones that sit underneath your first met head and in the tendon of what's called your flexor hallucis brevis. Okay, so they're in a tendon. To do sesamoid surgery, which is almost always a removal, they have to get into the tendon and sometimes cut the tendon or disrupt the tendon. So it is not uncommon to have someone who had a sesamoid removed to start to get this deviation, kind of like a bunion, or it's called a varus, where the toe goes the other way. So you want to use the spacers to keep the toes in nice alignment, because yes, it is common to have misalignment after sesamoid surgery. Okay. Great question. All this sensory noise becomes a fundamental prevention tool for any mental emotional condition. Yes, 100%. Lewis said that. Thank you, Lewis. Yes. So the other great thing about this is that sensory stimulation is very calming to the nervous system. So if people get quite excited about doing balance exercises, everything that we spoke about can help calm it. Or even outside of balance exercises, just please use this information to then enhance anything else that you're doing. Release the feet before any exercises. Use sensory to help them connect to their body schema, so that it'll calm mental and emotional imbalances or shifts. Love it. Love it, love it, love it. Okay. So again, for everyone, thank you so much. I had a link in the beginning. Let's see if it'll still, oh, it did. So here's a link. There's a May 21st neurosensory specialist, which we go into all of this, but even more detail. It is a one-day training, 10 a.m. to 5 p.m. Eastern. It is recorded. So David, another option is if you can't be live, you could sign up and then just watch the recording. That's another option as well. So for anyone, if you just want to watch the recording, if not, please do continue to follow EBFA and Naboso, as we have lots of education. Yes, there is NASM and ACE CECs. There's 0.8 for both of them. So there you go. If you need some of those credits, make sure you get those from some of our trainings. All of our trainings offer NASM and ACE. So that's something fun. Do check out Naboso. If you have any questions on the products, let me know. Everyone will be getting access to the recording and the PowerPoint of this lecture. Thank you guys so much. I hope that you enjoyed, and please do stay tuned because we have 3 other opportunities to learn this month from EBFA. Thank you guys so much.